All right, guys. So the lecture for today, we're going to take a little bit of a look at some skin conditions. Okay. So we're going to start with cancer. By definition, real quickly, just cancer is an abnormal mass of cells or cells that essentially just have lost their ability to control cell division. So there are two basic types. One is called benign. The other one is referred to as malignant. But benign are the best ones to kind of get because they don't spread. They're kind of what we refer to as encapsulated. So they stay as kind of these little small pockets of cells. Malignant is the worst one because it metastasizes, meaning it moves to some other part of the body. Those little cells usually push their way into the bloodstream, and once into the bloodstream, they kind of move throughout the body and then will lodge themselves other places. This is also one of the reasons why a lot of times we find them in like lymph nodes, because lymph nodes would be one of the first places a lot of those cells would get picked up. And kind of pulled out of there. So, skin cancer tends to be the most common type of all cancers. Okay. Mostly due to the fact that skin cells are being regenerated pretty much nonstop. So those are pretty most our most some of our most common ones. All right. I'm going to post this video like I did for the one for the skin gun, so you guys can take a little bit of a look at it. It shows you how, or shows you a little bit of the differences between the malignant and the benign tumors. Right. So when we look at skin cancers, there's a couple different types, and those are based on where they arise in the layers of skin. So you can get what's called a basal cell carcinoma. These are the least worrisome. They're also the least malignant, so they don't tend to travel. For the most part, this is because they're in that basal layer of epidermal tissue. So they're on the outer layer. They're a little further away from some of the blood vessels. Again, most common, and they arise from that bottom or kind of basement layer there. This is another video I'll try to make sure I post for you guys as well that talks a little bit about melanocytes and melanoma. It talks about the factors that affect with those. Okay. Malignant melanoma would be the most deadly form of skin cancer. These are the ones that actually affect the melanocytes. Remember, those melanocytes are in that lower kind of basal layer of tissue as well. They metastasize really easily because they're really close to both blood vessels as well as lymph nodes. And the process we use to detect them is called the ABC rule. So we're looking at a couple different factors here. We'll go over those here in just a second. All right, but this shows you a little bit of some of the stages of melanoma. So stage 1, you would look at just in the upper layer of the epidermis. Stage 0. Stage 1 then now starts to kind of push its way down into the dermis. Stage 2, we're a little bit further into the dermis, so now we're starting to affect like pressure sensors, sweat glands, and things of that nature. Stage 3, we've now reached the very bottom layer of the dermis. We're pressing up against sub-Q tissue. And then stage 4, which is kind of the end result of this, it's pushed through all of that and then into the sub-Q tissue and underlying tissue usually as well. Okay. Another one we look at is what's called squamous cell carcinoma. All right. So this is arises in the stratum spinosum. This metastasizes pretty easily into the lymph nodes, and then as long as it's caught pretty early, we have a pretty good chance of getting rid of it because it stays pretty well encapsulated. It's when it gets down into that next layer that we have a lot of the biggest issues with them. Okay. The ABC rule that I was talking about a little bit before. So A stands for asymmetry, B is for border, irregularity, C is for color, and D is for diameter. So asymmetry, we want to kind of divide the mole in half, and it should be pretty equal on both sides, both pigment as well as shape. Okay. Border irregularities. So we want to look at the borders of the mole and see if they're smooth, raised, if they've got a regular pattern to them. Okay. Color is another one that we look for. So is there different colors or pigments throughout the mole or kind of lesion on the skin? And then diameter. So anything larger than 6 millimeters in diameter, we would start to look at kind of either trying to keep an eye on it or looking at to see whether we've got some issues there. And some individuals actually even throw in a final letter E, which is called evolution. So is there any change in any of these that we just looked at before? So is there a change in color? Has it gone from more of a skin tone to a darker color? Has the shape changed? So was it once pretty regularly in shape and size, and now it's different? And then obviously if it's gotten bigger over time. This shows you a little bit that ABC rule as well. So here again, we're looking at asymmetrical. So so symmetry. So this is one here is symmetrical. You can see it's nice and round. This is asymmetrical. You can see the border is kind of ragged or kind of jagged around the outside. Even borders, you can see again, it looks pretty well encapsulated here on this one. They're fairly round. Again, you've got lots of different projections away from the border on this one. This mole is benign because it's one color throughout. This one is multicolored, so you can see it goes kind of from light to dark. So you can see there's some big changes in there. Diameter, this one is less than 1/4 of an inch. This one is a little bit larger than 1/4 of an inch. And then you can see here, this is the original scan, all right? And then this is evolution. So you can see there's a change in color as well as size in some of these moles. And that's to do, again, to just exposure to ultraviolet light, okay? Other conditions that we can take a look at, so they can be from bacterial to fungal. So this first one here is fungal. So this is athlete's foot. The upper layers of the dermis start to kind of slough off, and they kind of have this kind of scaly appearance. Usually there's some red appearance to this as well because it's starting to affect kind of the lower layers of the epidermis and upper dermis. But it's simply because of a fungal infection that's got into the skin. Usually, athlete's foot will have an odor to it, and pretty much all fungal infections, as well as bacterial infections, will have that to them. But again, they kind of have this weird kind of appearance because the fungus is actually feeding on the skin. Okay. Another homeostatic imbalance or kind of condition we have here are cold sores. They usually arise on the upper layers of the dermis, right on the lip itself or within the borders of the lip. These are caused by a virus. They're usually caused by the herpes simplex virus. They get kind of this crusty appearance from time to time. They can look like a blister. In some cases, it can actually even look like acne. Okay. Another one we can get is what's referred to as a boil or sometimes referred to as a carbuncle. This is a bacterial infection, and this one is associated with a hair follicle usually. So dirt, debris gets left on the skin. That gets down into the hair follicle and then affects the sweat gland or oil gland directly with the hair follicle. And then you get this kind of raised red appearance that's directly associated with one hair follicle or sometimes several. All right, you can see in this case, this is probably a couple different hair follicles here that have become raised in red. And also you can see it here, nice big red appearance, kind of a white pustule here in the center. That's all white blood cells, but that's pretty indicative of this kind of boil or carbuncle. A lot of times, like acne, just acne pot scars can become this if people try to remove the white blood cells that were within by essentially squeezing it or using some sort of a cleanser that doesn't really kind of clear the skin. It kind of plugs it. So it's important to kind of keep those areas clean. Okay. Another one we can get simply is contact dermatitis. So contact dermatitis happens when you become exposed to something that you have an allergic reaction to. You can see there's a couple different variations here. This person probably come in contact with some sort of soap or detergent that he was allergic to, and you'll see these kind of red groupings of kind of red marks. This is a henna tattoo that somebody was obviously allergic to the ink they used in the henna tattoo. So you can see any place where the henna tattoo is, they've got this red raised appearance. And here's another one, probably, again, contact dermatitis. They come in contact with something that was irritating to their skin. Could have been a chemical. Could have been a hand sanitizer even, so an alcohol-based hand sanitizer that had something else in it. But again, you kind of see this red raised area. No real, it's got a pretty well-defined border. It's only in the areas where they come in contact with the material. Sometimes we'll see this, especially in the healthcare field, if somebody's allergic to, say, like latex. The gloves that we used to use in the medical setting were primarily latex based because latex was pliable, it stretched, it was really easy to use for a glove. The problem with that is we find that a lot of people are allergic to latex, so they would have gloves on and they would take them off, and they would have this kind of appearance on their skin after they had them off. Actually, kind of personal experience, I'm actually allergic to latex or somewhat allergic to contact dermatitis to latex. I found that out after working a wrestling match in grad school. I had a pair of gloves on for probably 4 hours. So I would put a pair on and take them off and put another pair on when I was treating athletes. But the match ran for like 4 or 5 hours. At the end of the match, my hands were all red. They didn't quite have this appearance, but they did have this appearance, and I was pretty well allergic to latex at that point. All right. Another one that you can see, this one's a bacterial infection. It's called impetigo. All right. So again, the bacteria gets into the skin. You see this kind of red raised appearance. It usually has a border, and most of the time with impetigo is it'll be red, but it'll also kind of this yellow, kind of crusty appearance to it again because the bacterial is feeding on the skin. That's dead skin cells in the center with a mix of kind of white blood cells as well. But that's impetigo. This one's highly infectious. Whereas like athlete's foot, since it's fungal, it's not as infectious. You can also have, say, like ringworm. Ringworm is also fungal. All right, it grows in a pretty patterned circle, whereas this, you can see there's no real pattern to it, but you see this kind of infection here. Okay. Another one we can see is psoriasis. For the most part, we really don't know what kind of causes this one, but we do know that there are several triggers. People with psoriasis kind of get this silvery scaled skin, and it's just a thickening of skin, usually around the elbows, kind of around the hairline, but can be pretty much anywhere on the body. But those tend to be areas that are a little bit more prone to it. And again, there's no real rhyme or reason why people have it. It's not infectious. It's not contagious. So people can't get it if somebody else has it. It just kind of looks kind of ugly. It's in kind of red and raised and kind of irritated. Another one we can have is what's referred to as alopecia. So alopecia is actually an autoimmune disease where the immune system actually suppresses the function of the hair follicle. And it's usually pretty characterized by this kind of splotchy appearance. Whereas if somebody had like ringworm, you would see one little patch in a red circle. And then you would also see usually kind of a reddish or dying area in the center of that, where there's no usually red telltale signs that they have some sort of infection. They just have kind of splotchy appearance of their hair where they have it. All right. Some other things that we can see with skin conditions is changing due to aging. So there's a couple of things that really happen here. So the first thing that usually happens as we age, we see a decrease in subcutaneous tissue or that basement layer, which is why people who are older usually are intolerant to cold temperatures. They don't like being cold. If you got grandma or grandparents that are older, they usually keep their house a lot warmer than the rest of us because of those reasons. They don't tolerate that cold, or they're constantly have a sweater on even though it's hot outside. The other thing that happens then is the skin actually starts to thin itself, so we don't replace this tissue as quickly. So it leads them to these kind of bruising over time because, again, the skin's thinner. Any damage that they would get to a blood vessel shows up really quickly on the surface of the skin. We can also see a decrease in collagen and oil production, which causes the skin to become not only dry, but also usually very less pliable. So the skin loses its elasticity as well, because now we've lost a lot of that sub-Q fat that helps with that. So the skin tends to bag and kind of bunch around places, especially the eyes, underarms, chin. Okay, those are big ones that we tend to see. Things that you can do to delay that. So you can obviously keep the skin clean, protect it from the sun by wearing sunscreen or wearing long, loose fitting clothing. A healthy diet is actually pretty important to help kind of make sure that the skin has all the nutrients that it needs. Hydration is another huge one. We saw that especially in burns. All right, there's a lot more hydration that really goes into skin than you would think. Okay. And then one of the other big things that can kind of do that is smoking as well as excess drinking. And this really has more to do with damage of blood vessels. We know that smoking as well as drinking can cause damage to those blood vessels that are feeding the skin. And those are usually some of the first ones to kind of go. Okay. Another video on aging. If you're looking at just the lecture itself, you can kind of watch that one. It's a pretty quick one, but I'll try to make sure I post that one as well. All right. And then kind of skin reversal methods. So a lot of times people, especially in this thing, they start to ask, well, what about like Botox? Well, Botox is actually a toxin that's derived from a bacteria. So what it does is it causes the muscles in and around the face to actually relax, which gives people this appearance that they have less wrinkles. All right. It's for the most part, fairly harmless in small amounts. But if there's somebody were to give large amounts and give it right in and around a nerve, you could damage that nerve for the rest of their life. Also, a lot of times with Botox, especially you see these two different pictures, they're a little bit exaggerated, obviously, but Botox, they have this really flat appearance, and a lot of times they can't make a facial expression because, again, the Botox is actually deadening the nerve. This used to be a fairly popular treatment to make yourself look like you had plump lips. So they would put a suction device over the top of the lips to engorge that area with blood. It's very painful, and in some cases, the tissue here around the lip could actually split. All right. So there's lots of things that can go wrong with those different kind of treatments and whatnot. So I would just make sure you look back through a couple of the conditions, be prepared, especially on the assessment for Friday, that you could see kind of a section where they might give you a definition of a one of those homeostatic imbalances or conditions, and then you just have to pick the right one out. So make sure you take a look at a couple of those in preparation for that.